Welcome to ProtectYourBrain.com daily webcast. I'm William A. Van Horn, MD, a medical doctor who specializes in Alzheimer's disease. The purpose of the webcast is to help you and your family by answering questions, so please send me your questions at Twitter, Facebook, email, or the 800 toll-free number. Today I'm going to answer the question, what is a delirium? It's a very important question to know the answer to if you have a family member with memory loss. Basically, as we age, we lose brain cells over time. There's a reservoir of cells we can lose before we lose memory. So our brain's actually getting smaller, kind of less dense as we age. You have a little bit of what we call microvascular disease, ischemic microvascular disease, where you get loosened blood vessels clog off little brain that way. The significance of that is I refer to it as a fragile brain, that our brain doesn't handle stress as well. And when it doesn't handle stress, it predisposes us to like insomnia, low brain energy, anxiety, but it also predisposes people to delirium. Delirium is a state where all of a sudden the brain gets like drunk. So for example, if I have an Alzheimer's patient who's doing pretty well, let's say their mini mental state exam score, which is a full score would be 30, let's say they're a 17, which are about moderate level of dementia. And they know what state they're in, they know what city they're in, they probably know the year, but they don't know the exact date. So they're not real bad shape. And then all of a sudden Monday I get a phone call to my office and they say, Grandma's really confused and she's seen bugs. And it happens just like that. Well, that's typically a delirium, which is all of a sudden something's causing the brain to get out of whack. So people will hallucinate, they may get agitated, they'll get much more confused, they might get really lethargic and not want to get out of bed. So if you see a sudden change in your grandma, your grandpa, your mom, and your dad, well, that's probably delirium. Delirium is considered a medical emergency because sometimes things caused the delirium might be low potassium, which can kill you. Sometimes it could be something else. It could be a mild stroke, which would kill you, or moderate stroke. But delirium is considered a medical emergency, so it needs a workup right away. One of the ironic things for me, and over my years, my career, is when I learned that the most common cause of delirium is a urinary tract infection. Now, even as a physician, just logically, how does something that happens in your bladder make your brain confused? But it's about 60 to 70%. And I tell my family members, I tell them, if you see a confusion, get a urine checked immediately, even if you see a little confusion. The reason this is important is because often the urinary tract infection will start with a little confusion, and by the time it actually gets checked, they're really confused and out of control. About 25 to 30% of the admissions to the hospital where I was the medical director for people who were agitated with Alzheimer's disease was urinary tract infections. So you got to check it early, and if you start treatment early, what will happen is you keep them from getting really, really bad. So again, very simply, a delirium is where you see a sudden change in thinking ability from their baseline. They seem to be more confused. They could either be lethargic or very hyperactive, agitated, paranoid, screaming, yelling, hearing things, seeing things. And if that happens, get them to your doctor or get them to the emergency room and get a medical workup. I hope you enjoyed today. Purpose is, again, to answer your question. Please send them to me at Twitter, Facebook, email, or the toll-free 800 number. Have a wonderful day.